So this is Health Informatics Graduate Program Virtual Information Night. This is the first one that I've done. I think, Jacque, you've done one with Civil before?
The virtual ones are new this year. We would usually do these, in person, and it would usually involve pizza. So I'm sorry, there's no pizza tonight.
Yeah, I know. Yeah, especially because I haven't eaten yet either, so that would be great. This is my information, and here is Jacque's information. So if you guys wanted to have any type of contact after, any other additional questions, or how to go ahead and pursue either a MS degree in health informatics or possibly a graduate certificate, or just ask questions in general, you can go ahead and contact us. So my background, just really quick, is actually, it stemmed from cybersecurity and network engineering. So I've done a lot in terms of mostly penetration testing and hacking into different types of companies, working with the government to be able to give them vulnerability assessments and mitigation reports. And I did that for quite a while in industry, and it was good. I enjoyed it, chasing down different types of groups who were not so good in terms of doing illegal activities and things like that. So that was fun for a while, but for me, it didn't really have the long-lasting gratification. And I took a position at a mental health conglomerate. It was quite a few different types of organizations that kind of merged into one particular type of health system. And it was there running actually their cybersecurity area and systems engineering that I kind of found this niche. And so when I was asked to come here to Michigan Tech to start the CNSA program in 2004, I had every intention about starting a graduate program in some type of health-related area. And so in 2012, I started the medical informatics at the time, and that's been changed to the health informatics. And really the timing of it was great just because of all the different types of changes that's been going on in terms of paradigms of the healthcare system, which I'll talk about. But just the cybersecurity element and the artificial intelligence side of it has really just exponentially increased. And I'll kind of go over some of those particular topics. But if you have any questions, you can ask as I go through it. And Jacque, I'll let you go ahead and introduce yourself.
Sure, Jacque Smith from the graduate school here tonight. I'm a Michigan Tech alum, mechanical engineering. I've been in the university now for 15 years in various positions with Vice President for Research and Dean of the Graduate School. So I help students get through the process of applying to graduate school, and I'll be talking a little bit about that later. And that the accelerated, I'm going to be talking really about accelerated masters primarily. But if people have questions about, traditional masters at Michigan Tech or general graduate school questions, I'll be happy to answer them.
Okay. So I've taught, I think my last count was I taught 17 courses here at Michigan Tech so far. 15 of them I've created because just we were creating different types of programs. But what I'm currently teaching now, and Justin can attest to this because he's in 2 of my courses, security and privacy, which is at the graduate level, artificial intelligence in health, which is another graduate course. And then in the spring, I have clinical decision modeling and population health informatics. So a lot of those courses use different types of artificial intelligence and different types of cybersecurity. So with the different majors that we have here in terms of CS with software systems, and then obviously with CNSA and cybersecurity, your background is very similar to mine in terms of where I came from industry and then getting into the health informatics side of this. So I won't go over in great detail on things unless you ask for it. I know everyone's time is precious, so I don't want to bore you guys with different things. But I'm just going to give you some background about health informatics, then particularly to what our program offers, and then some different types of examples of interdisciplinary research. And I stress interdisciplinary because this is really what this field is all about. So as much as people might have a clinical background, there's just as much need for individuals who have that technical expertise. And then, as Jacque mentioned, he'll talk about the Health Informatics Accelerated Masters. And then any questions that you don't ask during the presentation and you want to reserve for the Q&A session, you're more than welcome to be able to do that. So if you don't know what health informatics is, and many people don't, it's really the intersection between CS, information science, and healthcare. And so when you look at all the different types of data sources that are out there, if you think about it, and you go into a hospital and you give them your information, your labs, your vitals, your blood pressure, all of those different things, they have to record it somewhere, which is going to be an electronic health record. And then they take that information and then merge it with other things that may be there. So if you had an X-ray scan or a CT scan or an MRI, that's going to be aggregated. If you had different types of mobile health applications like behavioral health, maybe tracking your moods or tracking your blood glucose with some type of Bluetooth glucometer, for example, that information will be tracked as well. And so what health informatics does is it kind of utilizes this technology and all these separate data sources to be able to come up with this information, really looking at holistically the patient. And more research has shown that, just by looking at what is being done in the 4 clinical walls that you have, like in a hospital or clinic, isn't sufficient. So they need to be able to bridge these different types of gaps in care with different types of technologies. So as you're using these mobile health apps and these different types of remote devices, even pacemakers, different types of insulin pumps that maybe if you're diabetic have been implanted within you, these types of things are allowing you to be able to stay healthier longer, right? That's what the whole mission statement is. And they've been learning that even things like biosurveillance, different types of social determinants of health, maybe you have medications that you've been prescribed, but if your social determinants of health don't allow you enough money to be able to eat and take medications, then the medications aren't really going to be able to do anything if you can't take them because you can't afford them. So there's many things that call on the needs to have individuals with expertise into data storage, different types of artificial intelligence, cybersecurity elements, all of these things that are so important to people in the medical and healthcare field. So that's where this really comes into this interdisciplinary healthcare teams with this training to be able to supply this expertise. And so even if you looked from a strictly clinical part, which all of these different ones, the CDC, as you're probably very familiar with in terms of a lot of the different types of COVID parameters that have been coming down, the World Health Organization, the National Institute of Health, and the Agency for Health Research and Quality. These are just a few of the different types of organizations that have went out and made public statements about the interdisciplinary need and the specification of health informatics to be able to continue up into what they have is currently the patient population of 2050. So when you start looking at the expansion between healthcare, computer science, and information science, health informatics plays a pivotal role in terms of doing this. And that's why this particular type of dedication to technology and the clinical field has become so important. And so one way to look at it is I often get the question, why not just go into data science, right? Because you're doing AI, data science has some form of cybersecurity, even though it's not as probably as prevalent as what you would see from a cybersecurity master's. But really, when you look at health informatics, and the reason why health informatics has typically a larger salary is because it's a subspecialty. And that's maybe what some people don't understand is health informatics is a subspecialty of cybersecurity, a subspecialty of data science. And what I mean by in terms of the subspecialty portion for it, if you can do cybersecurity, and let's say you can do AI algorithms for cybersecurity where you can go ahead and monitor all of these Internet of Things devices, then maybe somebody would think, well, then you should be able to monitor Internet of Medical Things devices, right? Like the insulin pumps, the pacemakers, the ventilators, the MRI machines, all of those things that I just spoke about. But the thing is that what is actually transferred in terms of health information is much different than what you would see from other types of sectors. So financial sector, government sector, those kind of things, they have their own format for how they go and exchange data. So there's things like Health Level 7, HL7, different types of codes, as Justin, who's in my class, knows, like CPT codes, ICD-9, ICD-10 codes. So where we get different types of individuals who come into this, they really see the difference in terms of the data sets that you're working with and being able to interpret those with the knowledge that you have. So if you have just a data science knowledge, you won't be able to interpret the data much like if you just work with cybersecurity. So this is a subspecialty of certain areas that allow people to have a specified focus and expertise that is really in demand in terms of where things are going. And so the differences in terms of how this actually works in terms of these interdisciplinary teams is that really you're trying to go ahead and have this information to make better decisions. So we want to be able to give cardiologists for different types of more data for congestive heart failure, for example. We want to be able to give oncologists better type of predictive values in terms of how a medication would help somebody with liver cancer, for example. All of these things make a big difference in terms of these predictive analytics that we're doing, or different types of forms of taking information and being able to set up these different forms of treatment for individuals as well to help them get better quicker and longer. And so you have a lot of different type of diversity of health data, and you can just kind of, this gives you an idea, right? If you look at genome data with proteinomics, you have a lot of the image data that comes through. Here's a chest x-ray. Different types of mobile devices that you have from phones, lab tests, what people are posting on social media. And so this is something that we're looking at right now in terms of one of the projects that I can talk about. We're looking at COVID disease pattern prediction and supply chain. And we're actually using Twitter, different types of tweets from Twitter to be able to geotag individuals of where they're at and be able to predict what the disease pattern increase is going to be based on their tags and what they've used. So if they've specified like hashtag COVID, hashtag COVID-19, hashtag shortness of breath, we kind of look at that information and derive algorithms in addition to other data sets to be able to show from a geographic region, which includes the UP, to be able to go ahead and depict what the prediction would be and then what types of things we can do to remediate that. So having that knowledge of computer science, having that knowledge of understanding how databases work, and pulling that information from those data sets, that puts you at such an advantage than others trying to go into this field, just because the learning curve is a little bit steeper for them. And then the healthcare's paradigm shift from fee-based to value-based. This is really critical because before, imaging is a great example of this. So you could go in before and you could have a broken arm and they could say, you know what, we need 6 x-ray views to be able to look at this. And then you get those x-ray views and then you come in 2 weeks later and they're like, no, we need to have 4 more x-rays. And so they can keep charging because it's fee-based, right? So the more x-rays they take, for example, the more that they can charge the insurance companies, which at the end of the day charges you, and you have to pay that amount. So now healthcare has shifted to value-based, which means that if you take 6 images, can you validate of why those 6 images, what's the value that the patient's getting? And so now all these healthcare companies, these organizations, these hospitals, these clinics, they're all scrambling because they don't have any way to actually evaluate what is classified as quality improvement. Are you improving the quality, the care, the safety for the patient? And so they need people who know health informatics who can be able to demonstrate what those are. And if you think about it, everything comes down to money, whether you want to admit it or not, right? So the way that the healthcare organizations and the providers, which are physicians, specialists, those types of individuals, the way that they get money is through reimbursement. And so if you're able to show that your quality improvement has helped a larger population in terms of, let's say, diabetics, or let's say people who have Alzheimer's disease, if you're able to show that through analytics, then you get reimbursements from the payers, which is your Blue Cross Blue Shields, your Aetnas, those kind of groups. So they are just searching for people who have this knowledge so that they can be able to give them this information and they can send it to different types of payers to then get reimbursed and be able to go ahead and have, offer more services and more types of offerings from their healthcare organization. So it's not as if it's just in terms of patient safety and those kind of elements, which are really important, but it's also a monetary portion for this as well that they need to have individuals who know that that value is going to be set and that they can demonstrate it. And when we say value, this isn't just making sure that you're able to go ahead and improve the health of your patients. This also is quality improvement in terms of securing the data. So if you cannot show that your data is certified in electronic health record, that it's secured in terms of encryption at storage and transit, all these different types of elements that they have, then you will not be reimbursed as well. So they need cybersecurity individuals. They need people who are data scientists who know AI and understand the healthcare field in terms of the different types of data sources to be able to show this information. And they also need to compete against other organizations. So they need to be able to say, yes, you can use your Android phone and you can use your Apple phone and you can use any other type of device and still make it work with the different types of things that we're doing. So all of these different elements are very, very critical. And again, they need to have this expertise. And this is why, again, you have these lucrative salaries in this field, because it is a subspecialty. And to me, it's exciting and gratifying. And this is something that, as I said before, I enjoyed the cybersecurity field very much. But I do find personally more gratification for having the humanistic elements of helping people this way. One of the physicians that I had as guest speaker said something that was it was really important. He mentioned that on a given day, he maybe will help 10, 12 different people. And he said with the power of being able to do health informatics, you can reach hundreds, thousands of people every day through the different types of models that you have or the different types of cybersecurity elements that you're protecting, all of these different types of things. And so this is why this field to me and to many others is really exciting. And these are some of the students in my lab. Tim, as you guys might know, is a PhD student for me. He also is a lecturer in CNSA. But this is using the Microsoft HoloLens that we've developed an algorithm to be able to show the patient's medical record and then be able to assess different types of things using sensors. So temperature, blood pressure, pulse oximeter, all of these things, so that if the individual is 300 miles away, you can still be able to read this, because this is using facial recognition to be able to bring up these medical records, which again have to be authorized. So there's a cybersecurity element to that. So the market outlook, just to give you, I'll go over this rather briefly, but so here's some of the main areas. So artificial intelligence in healthcare is growing very large. Population health management, and again, it's based on that particular type of reimbursement of value-based. Can you go ahead and manage your population who's maybe high risk, right? So diabetics is a big one. Obesity in terms of the population. Different ones with chronic diseases is more ongoing diseases are the ones that are difficult to manage. So these are the ones that they're trying to focus on the most. Remote monitoring, especially with COVID, is a big thing, making sure that you can go ahead and monitor individuals who might be quarantined or have different types of medical conditions. We do a lot of this for the elderly in terms of fear of falling and balanced confidence, to be able to do remote monitoring using mobile devices, the sensors in them and the watches from the accelerometers and things like that. Healthcare security and privacy, I'll talk about that in a second. Biosurveillance with a lot of the different types of, usually it's flu as one of the big ones, but now it's COVID. Precision medicine is important, because if you think about it, how many times have you maybe taken a certain type of medication for a headache, for example, but you don't know exactly how that medication is going to be able to work with your own genome data and maybe your own type of digestive tract, because there's a lot of different changes in terms of how medications can be for individuals in terms of what the response is. So this is looking at customized medication based on, or different types of medicine treatment that you would have based on your particular type of genome and how the different things affect it. And then there's a huge medical professional shortage, not just in rural areas, but just globally. And so being able to go ahead and use artificial intelligence to provide different types of clinical decisions that physicians can use to go ahead and see more patients. So it assists physicians a lot in terms of making those particular types of decisions. And for those, like for me, who I've started a company recently, the entrepreneurship in terms of doing this, whether you want to start one yourself or if you want to be able to join different types of startups for transforming healthcare. These are just some of the examples with AI, and you can kind of see, nutrition, emergency room surgery, virtual assistants, wearables, different types of medical imaging and diagnostics, patient data and risk analytics. So there's many different types of fields, and this is just a quick snapshot of it. But just to give you an idea of how much is actually being put into this, there's quite a bit of opportunity, especially for people who are coming out of the field, to be able to join these with their creative ideas and really make an impact very, very quickly. And then just the average cost that you would have for a data breach at a healthcare organization is $4 million. This has actually increased in the past 3 months. So it's just getting larger. And then $65 billion is expected between 2019 and 2024 in terms of just healthcare cybersecurity spending. So if you look at jobs on the market in terms of how much is there for individuals with cybersecurity knowledge, there's a lot in terms of that as well. And so if you don't know, since 2014, the healthcare sector has been the highest hit sector in terms of a public domain because of the data that it holds. And so people who have taken my class know this, but if you go ahead and steal my credit card, you'll probably get about $1 on the dark web or black market for that. If you steal my basic health information, you get between $150 and $500 immediately, right? So it's much more lucrative because you can make a visa, you can go ahead and make a driver's license, you can do healthcare fraud, you can do insurance fraud, you can do many, many things with it. And so the information is a lot more lucrative for an attacker. And again, that's why people who know that cybersecurity knowledge, the salaries and the type of work goes up for people who have that in the healthcare sector, just because it is so much in demand, because all of this is confidential information, sensitive information that's sanctioned by HIPAA. And so again, this is protected health information, protected identifiable information that cannot be leaked out. And so this is why when healthcare organizations get hit, it's so expensive. And these are some of the things of why they want to hire people like you. With that background, our program has been designed to meet these needs. And again, this is highly interdisciplinary. We have pretty much a split. I don't know if Jacque has any numbers. I wouldn't anticipate that you do, but when I checked last time about 4 months ago, we are pretty equal between what we attract as clinical personnel and what we attract as more technical computing personnel. So that would be CS, cybersecurity, CNSA, and those types of majors, in addition to even computer engineering, in addition to people who have biological sciences, even biomedical engineering. We have pharmaceuticals, we have dentistry, we have quite a variety, different types of physicians. We've had emergency room physicians, primary care physicians, and specialists, even an anesthesiologist who have gone through our program, in addition to quite a few nurses as well. So it's very interdisciplinary, which I think is great because, especially for the classes themselves, when we do have non-COVID classes that are live and everybody's there, it's a great discussion because you get a lot of different type of feedback from the different viewpoints and experience of people. But it's a very highly interdisciplinary program. I'll go over some of the courses here in just a sec. But we offer a thesis, which would be a traditional thesis option. We have a report option that's, it's been mostly reserved for people who are taking classes as they work full time. They're typically at different types of hospitals or research institutions. But we do have that option for students here as well. And then there's the coursework option as well. So at the end of the day, you need to have 30 credits to be able to graduate, whether those 30 credits come out of coursework, or if, for example, 24 of them come out of coursework and 6 of them come out of the report, or 20 come out of coursework and 10 of them come out of the thesis. That's kind of up to the individual. But upon acceptance into the program, I go over, contact every incoming student with a Zoom meeting. And so we go over different types of things that they are interested in. We use the graduate school's plan of study. And so we go ahead and use that individual development plan to come out with a semester by semester type of schedule for them. And then as they make different types of changes, we meet once a semester to make sure that we go ahead and update that. And that way everyone's on the same page when they're getting, of course, towards graduation. And it makes the process easier. And it also allows me to contact different types of networks that I have to establish different types of internships and different positions that they might be interested in. So we do offer 2 new graduate certificates in addition to that, which I'll go over shortly as well. But you can take these within your 30 credits of your coursework. You can also get the graduate certificates included within that, which is a tremendous thing. Or you could just register for the graduate certificates after you get into the program, and you don't have to go through the MS portion entirely. You can just, do these kind of ad hoc, the graduate certificates. And I think Jacque will talk a little bit more about those too as well. And then health informatics graduates are very in demand within industry with competitive salaries. We're over 100,000 in terms of the starting salary. And again, we have a lot of clinical personnel who come in into that. So some of the places that our students have gone to, so University of Michigan Hospital, Beaumont Hospital, the Mayo Clinic, but even places like Google, Los Alamos National Lab, they've been hired, Ford, NASA, electronic health record organizations like Epic and Cerner and IBM are some examples of where students have gone. And then the faculty, I'll just go just to show you. There's me. So UCI does different types of security elements, and that includes some of the work in health informatics. Donald Peck, Dr. Peck is actually a medical physicist, and he's from Henry Ford Health, which is one of the institutions that we have a formal relationship with in terms of acquiring data sets and doing research with. So his research interests are analytics, medical imaging. Jinshan Tang is another one who's heavily research embedded in terms of biomedical imaging and medical image analysis. And Weiwa Zhao is relatively new, but he does a lot with different types of cardiology imaging. And that's really his strong suit and where he's kind of put in a lot of his research. And then we have some adjuncts who are in industry. So Dan Boyle, who does a lot in terms of the system analysis and design course, is in industry and kind of goes over a lot of the different types of elements of that. And then we have a physician, Dr. DeLynn, who's the chief medical information at UP Health System and now has his own private business as well. And kind of give you an idea of some of the different types of research interests that he's in. And then the last one is Cam Williams, who's now with kinesiology, integrative physiology, and mainly with the DPT program. So this is the doctorate of physical therapy at Central Michigan University. So we have a lot of different expertise and a lot of different types of knowledge, which is great, especially for the coursework that we have, as you can see. So there's a certain amount of courses that are required, and then elective courses. And within those electives, if you choose to do non-coursework and you want to be able to do the report, you would take the SAT 5998 course. If you want to do the thesis, you would do the 5999. But so these are the courses when you come into the program to take an introduction to health informatics to really learn about what the health informatics field is all about and the different types of elements of what is being required and where industry is going. And then the security and privacy, as Justin is in right now, kind of gives an overview of the different elements of why things are different in terms of the healthcare clinical field and the cybersecurity elements that go into that. And that would include even some different types of programming with Python that would be involved with that to do different things like SQL injections, different types of penetration testing, and even cross-site scripting attacks and things with XML as well. I feel very good that I can use acronyms with this group because of their background in terms of computing. So you guys are making it easy for me. Artificial intelligence in healthcare goes over a lot of different types of topics of introducing you to the AI portion for it. So we do a lot with machine learning, computer vision, are kind of the big ones. Looking at natural language processing, which is a very big part of this, because 80% of your electronic health record is actually narrative notes, which is unstructured. So it doesn't match up to anything. So if you take a lab result for your blood glucose, for example, there's a definite type of field that goes into, or your blood pressure might be a better one, that it shows what that particular blood pressure was done when they took your vitals. And in terms of narrative text, it's so helpful in terms of getting that information, but we need natural language processing to be able to develop these algorithms to actually put it into something meaningful and join it with the structured data. And so as research examples that I give show is that the accuracy for prediction is a lot higher when you go ahead and use natural language processing in the narrative text of clinical notes. And so that's a portion that we get into. So we cover cardiac imaging, imaging with mammography. We do a lot with predictive analytics, getting into causality in terms of different types of biases and things like that in that particular class, which again introduces you to different elements of Python in terms of the programming that you do. And then system analysis and design is really looking at the workflow elements of the healthcare field, which is different. So if you develop this, I'll give you an example of what I did. I developed this really functional app that did a lot of things in terms of being able to analyze an individual based on the different types of sensors. But it didn't really, at the time, it wasn't constructed well to be able to be used with the different forms of the work environment, embedding it into that particular workflow. And so that's a challenge because physicians are very, very picky. And they don't like your logo to change on your mobile app. They don't like any of those different types of changes on it. So when you do those kind of things, it can really affect how much they use it. And again, if you want to be able to have the patient improve the experiences, the docs need to be able to feel comfortable with it. So system analysis and design goes over the scientific process for that, but we also introduce kind of the real world analogies that get into that as well and bring in different types of guest speakers from industry to be able to show of what things have worked and what things haven't worked for it. So we try to bring in as much type of real world application to this as possible. Even though getting doctors and things isn't always easy, we do a lot in terms of trying to get them in for guest speakers on certain types of topics. And then here's some of your electives that kind of coincide to the graduate certificates in addition to other elements. And so you can kind of see, I'll just tell you some of the new courses that we're going to be offering. The Introduction to Programming in Health Sciences and Engineering. So people who may not be coming out of the computing background don't know Python very well. They don't know how to connect to databases very well. And so this is pivotal in terms of the more sophisticated AI classes that we have. So we are now introducing a programming in health sciences and engineering to be able to help those like biological sciences, biomedical engineering, people who have degrees in a doctorate in pharmaceuticals or something like that. So there's a big difference in terms of what their past experience has been. In addition, we do a course with medical, like anatomy and physiology, that technical students can take to be able to make sure that they have a better knowledge in that area as well. Introduction to Big Data Analytics is a course that we're going to be creating, and we're going to be offering this for data science and for health informatics. So that's another one that we're offering. And then Applied Machine Learning in Healthcare. This is going to be a continuation of the artificial intelligence in healthcare with a lot more emphasis on the applied portion of machine learning. So you're going to be doing a lot more projects that are based on different types of real world code that you're going to be developing in terms of developing these type of solutions for different things like for cardiology or Parkinson's disease, those type of things that we're going to be having you go through. And those are the main ones in terms of the new courses that are being added, but you can kind of go through and see machine learning and cybersecurity is the one undergraduate course that's going to be offered for the first time this spring that we're including within this as well. So any questions on any of the courses that are there? These courses here are for other individuals who maybe want to be able to branch out a little bit more into the theoretical portion for it. So data mining, machine learning, predictive modeling, information system management, and time series analysis and forecasting are some of the courses that I thought would be good in terms of being able to give a wider scope of electives for people within the health informatics field. So here's some of the stackable certificates. So we have 2 of them right now, and we're thinking about introducing a third, which will go forward hopefully for fall of 21. Artificial intelligence in healthcare is one, security and privacy in healthcare is the other one. And I'll just show you quickly the web page on this. So if you go to it, you can kind of see the difference of information. So a little bit of background from it, the curriculum that you have, and you can see that these are both going to be 9 credits. So it's 3 classes, 2 semesters is basically what we had planned as being for the traditional student. We recognize that students may have different schedules. They may have an internship, things like that, co-op that may slow things down, but essentially you can get this done in 2 semesters. So you have 2 required courses, and then you have elective courses where you want to take that we offer in terms of the third one. So introduction to artificial intelligence in health, population health informatics, and then clinical support modeling, application integration, interoperability. There's other electives that can go into this for you to go ahead and choose. And so that's one of them. And let me just go through and click on the link for the other. And security and privacy is the other one. So Justin already has one for each of them since he's already done the AI in health, and he's currently in the security and privacy as well. So this gives you, again, secure and protect the privacy of health information. A lot of this is with compliance, and this is a lot of the things that you'd be doing is kind of what I've done in the field from a penetration standpoint. So you could either be a third party that's doing this for healthcare organizations, or a lot of the different ones like Booz Allen Hamilton contacted me last week wondering if we had people who knew different types of penetration testing in terms of the medical area, but also the financial sector. So you get a lot of these different types of organizations that have a wide scope of penetration tests that they do. And so they kind of are looking for people who have these different types of expertise that can float between the sectors. And there's some that are just strictly medical and health itself, but these need to be done annually. It's a requirement by HIPAA. So you'll see a lot of different types of advertisements for positions for different types of penetration testing and compliance, whether if it's third party or in-house to the organization. And then a lot of these is interoperability in the exchange of healthcare data. So you may be able to have your records stored at, for example, Portage Health, and let's say the Mayo Clinic. But the electronic health records, the Mayo Clinic is Epic. They actually just switched over 1.5 years ago. And at Portage Health, it's eClinicalWorks. So those 2 systems actually do not talk well to each other. So there's different types of formatting that has to be done. So if you're going to be getting data from the Mayo Clinic at Portage, then you need to be able to include that into the medical record. You don't want to just append that as a PDF, for example, because it's not going to help you with any types of analytics, as I mentioned before, to show that you're really improving the health and safety of the patient. So they look for people who understand the health level 7 and the different types of code in terms of exchange. So everything that you've done in terms of encryption levels, everything that you've done from in terms of database queries, all of these things, they all pay dividends because they're all very much centralized around this, this area of data interoperability and exchange for the healthcare information. So I hope you can start to get a picture of why the background that you had is so important for being able to move forward into an area such as healthcare informatics or health informatics, because it's so widely used in terms of the root actions of those things. Just the different layers on top are different. And those are kind of what the program is for. So yeah, it's kind of the same thing. This actually 6 credits of required courses. And again, it's 9 total in terms of 3 credits coming from the elective. So as I mentioned, the security and privacy, and then the security penetration testing and audit are the 2 required courses. And then there's 3 additional courses that you can choose from. And I am going to be adding the machine learning and cybersecurity. So if people take that, which I believe Justin is taking in the spring, that will also count because you can have 1/3 of your credits coming from an undergrad in terms of this. So at least that's what Nancy told me. So I hope that's correct. So yeah, we're really excited about these, and we've gotten a lot of interest internally, obviously the students who are already embedded into the program, but I've been getting other calls, which I've been very pleased about, from outside sources of people who are in the medical field, particularly different types of physicians who are looking at being able to get continuing education credits into these different types of fields. So those are something that we're going to have to look at as we move forward. But yeah, so that's the the two certificates, and again, they're embedded into the program in terms of the courses, so you wouldn't need to take those separately from the courses that you're taking into it. And the benefits, I want to be able to stress this on one example. The University of Michigan and Michigan Tech in 2012 or 2011, we both started a health informatics program. Dr. Friedman and I had to review each other's work because as both state schools, we needed to be able to send the other party just basically what we're actually doing and to show the differences between it. And so theirs is more based on healthcare policy in health informatics. Ours is more based on different types of computational use. And so we do a lot in terms of the technical components of, as you can see, artificial intelligence and different things like cybersecurity elements, these types of things, right? And image analysis. And so when you go ahead and apply for a position and you're going against somebody from the University of Michigan, for example, who also has an MS in health informatics, there's really not too much to distinguish you from those individuals just based on the name of the program. So this gives you definitely a lot more type of information to your potential employer in terms of what kind of knowledge base you have. So you would have artificial intelligence in healthcare and security and privacy in healthcare certificates to coincide with that Master of Science in Health Informatics. So this is something that industry looks at as being very much in need. And that kind of separates you from other people. Now, the other type of difference with this in terms of the benefits is that we've created these particular types of certificates to coincide with actual certificates in industry that you would sit for. So take, for example, the security and privacy. So there's a security and privacy information security officer or security practitioner that would be involved with taking this. And so if you have a certificate and you have a Master of Science degree in those areas, then that gives you more points on what they classify as the 7-point system. And so that would give you a possible 4 points. And then by having 1 to 2 years of industry experience, that gives you 3 points to be able to sit for that exam. And so what we've seen in terms of research is that if you go ahead and are able to sit and pass that exam, which you should be able to based on getting this particular certificate with the education that we offer, then that gives you a bump up of 10 to 15,000 of your salary. That's just what it's at right now. So we hope that that will just continue to increase, but that's just to show you that there are some different types of advantages in terms of getting a certificate to coincide with your Masters of Science in Health Informatics. Okay, then I'll just get into a little bit about some of the research that we do. And then if you have more questions after, I can hang around as long as you want to be able to answer the questions about research and development in health and medicine. We do a lot with mobile health apps, artificial intelligence, and of course, privacy and security. But a lot of this comes into computer vision, image analysis, being able to find this region of interest to find different types of cancerous masses, different types of bones that may be broken, to do different types of algorithms. And so we do a lot of image analysis with deep learning. And so even though we do supervised learning to some extent, a lot of the different type of research extends more into unsupervised learning or deep learning. So the best example I can give you is if you have a bunch of different types of results that come in, but you don't know exactly what it's going to be able to find. And you can think about something with COVID, that maybe there's a neurological disorder that they're now finding with people who have had COVID in terms of different types of predictions, then we can go ahead and use those particular things in almost like a cluster. So if you've ever done K to the nearest neighbor, for example, how that information would attract to 3 different clusters, which one it would be most attracted to would be basically the result of what would be the analysis of that particular type of research. So it's more sophisticated, it's more complex. It's using different types of convoluted neural networks, which is CNNs. And all CNNs are, they're not that difficult. It's basically just filtering, right? So instead of going ahead and saying that that's a particular dog based on the ears, we're now looking at the tail, the fur, the eyes, the nose, the mouth, many different types of elements as we go ahead and pass it through this image. So it's looking at a deeper analysis of the different types of images as they pass through, right? So these are the type of things that we're working on. We do quite a bit with sensors and patient-generated health data based off of the mobile apps, and I'll kind of go over that. And then, as I mentioned before, showing you some of the stuff with the HoloLens, a lot of different elements of virtual reality, augmented reality, but I'm more interested in mixed reality, which is putting things in the natural environment. So we build these holograms out of this particular type of HoloLens that can be in the natural environment. It can scan the natural environment and then put things into play. So I'm looking at being able to help train EMT individuals for different types of emergency medical technicians in terms of giving them different types of scenarios, such as one that I'm working on is a baby who's in shock. There's a lot of problems with being able to give a certain type of dosage. Actually, it's very unfortunate, but sometimes they give an overdose based on not being able to adjust the right weight and height for the baby in terms of what the dosage should be. So we use different types of things like holograms to be able to come up with a certain type of size and weight that they should be looking at. And then based off of that, how they put this individual into an ambulance, and then using natural language processing to be able to tell the emergency room doctor the right types of words to understand what exactly the problem is. And so this is something that we've looked at in terms of patient safety. That we're trying to look at, and yeah, something that I'm very interested in. So that's one example. And then some of the places that we collaborate with. So Henry Ford Health Systems, we have data sets, formal agreement with them. I did my sabbatical in Brazil. So Baiana University is a medical school there. That I did different types of work with. I was there for 4 months and did different types of rotations with cardiology, orthopedics, oncology, was actually involved in 21 different types of surgeries where their HIPAA requirements are a lot less. So I was actually able to stand right next to the surgeon during these. So I've seen a lot of surgeries as of that time. And then when I go back to visit on some of the work that I'm doing with Zika studies and things like that. So we get a lot of data sets from them, which is great because it's international data that we can use. And another formal agreement that we have is with Upper Great Lakes Family Health Center, which is helping a lot with the different types of COVID testing, as you're probably aware. They're a federally qualified health center. So essentially their mission is to go ahead and give the exceptional healthcare regardless of a person's ability to pay. And so this is really trying to tackle a lot of the issues of people who can't afford healthcare or don't have health insurance in terms of giving them the best tools available to maintain their health and be able to find different types of resources. So I'm kind of working on a platform that's community-centric that connects people's different types of health information to community resources and organizations such as this, and it does it in a secure format. So that's one group that I'm working on with that. So just quickly, this was a particular problem that with the Brazil group that we worked with, that they were having issues with being able to analyze gait analysis for different types of individuals. If you can imagine somebody walking with a cane that uses it, it's almost like a tripod that they're looking at. So the gait analysis that orthopedics would do in terms of pre and post surgery, people with different types of disabilities that they're trying to get corrected through surgeries. And so this would give different types of information, but what we learned is that we wanted to do it markerless. We didn't want to have any types of sensors that they had to put on their body because those might be put incorrectly or they might not be functioning very well. So this is basically looking at gait analysis through a markerless type of gait system. And we developed an algorithm that allows you to go ahead and when you have an occlusion between your walking of your feet, and you can imagine if you're walking sideways and there's a camera looking at it, it can't really see the other leg, the outside leg, based on the occlusion of the inside leg. So we did an inference algorithm that was able to infer where that particular joint was. And we're kind of continuing that now in terms of what we're doing with fear of falling on different types of older adults in terms of being able to reduce their fall risk. This is what I was talking about, the unsupervised geo model for temporal disease pattern of pandemic outbreak and disease planning. And so this is just basically we're looking at the Markov chain, which is different types of hidden elements that get put in terms of the observations. And so we're looking at people's comorbidities in terms of medical knowledge, medications, but also looking at the age, the regional data, and getting into the social data that I was kind of mentioning before in terms of looking at different types of predictions with Twitter. And then we're using that in terms of Python to come out with different types of models to accurately predict. And so we are working with the Michigan Primary Care Association, which has 91 different types of organizations around Michigan. So we have Lower Michigan and Upper Michigan, right around 800,000 different types of patients that are involved with this particular study. And then this is a little bit with the maintaining independence in older adults. So the research on this area is really it's fascinating in the respect that older adults themselves are much more, their health increases dramatically if they're able to go ahead and maintain their independence. They're able to do what's considered the activities of daily living. So that means feeding yourself, being able to go get groceries, tying your shoes, these types of things that we kind of take for granted. They can be a struggle for a lot of individuals. And so if older adults have falls, the statistics of them going into assisted living and having that independence reduced is very, very high. Plus, it's very costly in terms of healthcare percentages as well. So this is basically looking at developing a type of structure that better recognizes certain types of falls when they're going to happen. And it helps train individuals using different types of methodologies for balance and strength to be able to do this in addition to doing a steadiness score. So this project actually takes what I was talking about with the Connect, and it matches video to motion. So nobody has done that yet in terms of an algorithm to have for fear of falling. And so we thought about the premise of this and started to do some of the work, and we realized that getting an alert of falling actually makes you fall more. So instead of doing an alert, we came up with a steadiness score. And so this was motivation that if you're doing these exercises to be able to increase your balance, to reduce your fear of falling, this steadiness score kind of keeps you motivated because we use different types of things that show that you're actually improving the lowering of your risk of falling. And so we're using different types of sensors, not just the accelerometer of being able to go ahead and have somebody's body fall, but we're using it if you're walking on a particular type of ramp or something that could be a steep hill that could contribute to falling. We're using the LED sensors on your watch to be able to depict if you're walking in the darkness, and that would contribute to falling. We're looking at different types of elements for the temperature and being able to depict if it's raining, because that would be a slippery surface for you as well. So all of these things are basically aggregated together and to provide this steadiness score and to increase your balance confidence and then reduce this FOF as just fear of falling. The two biggest psychological parameters in terms of why people fall. And so this is something that we're working with the Michigan State University Extension Center, which actually puts on these fall prevention classes and wants to be able to look at how they can utilize technology to help people after the classes maintain this particular type of lower fall risk. But this is some of the work that we're doing with Henry Ford Health. And so these are all de-identified images that we have. So there's over 8,000 of them, all with wrist fractures. That was coming from Henry Ford Health in Detroit, Michigan. And so this is looking at particularly triaging patients or prioritizing patients in an emergency room. So a lot of times you don't have the staff or the amount of time to be able to know who should be seen as the most immediate and kind of go down from there. So this is looking at multiple views to be able to depict and use a deep learning algorithm to go ahead and set what the triage priority should be on patients as they come into the emergency department, so that the staff can go ahead and work on them. And then this model also does anatomic localization so that it can come up with certain types of measurements that can be put into the radiology report. And it isn't so time consuming for radiologists to go ahead and have, so they can work more efficiently. So I can talk a lot more about that one, but I know my time's getting short. So I'll let Jacque go ahead and take over.
Oh, that was an amazing overview of your program, Dr. Hembroff. That was very, I learned a lot. That was very good. Thank you. Just two little points I did want to point out. We were talking back about, the program is available coursework, report, or thesis. When you're accepted into the program, you're basically kind of coming in coursework, and you can determine your path. You don't have to know, like, oh, I'm going to do a thesis and this is what it's going to be. You don't have to do that to start. You're welcome to start to formulate those ideas and work with Dr. Hembroff, but you can figure a lot of that out at the start of the program of what your path is going to be. The other thing was you were talking about the certificates, and that is a fantastic addition to this degree in this portfolio, because you're ultimately saying here, you have the ability to graduate with 3 graduate level credentials while doing your master's program. You'll have most likely some of the certificates earlier. So if you're looking for internships, or if you are thinking about co-ops, you will have a credential that will make you stand out from other applicants for those positions. So those are fantastic additions to this portfolio of educational opportunities here. So if you want to, and I introduced myself at the beginning. A lot of what I'm going to talk about tonight is more just the logistics of accelerated masters and the information you need to know. So the master's degree itself, I often say it's not a question of if you're going to get a master's degree, it's a question of when you're going to do it. And there's no perfect answer. It's when it's right for in your life, and maybe you graduate and go on later. But what we're doing with the accelerated masters is we're trying to streamline things and make it as easy as possible to just continue on and take that next step and get that advanced credential. So master's degrees will help you advance in your career, allow you to take on leadership roles. Dr. Hembroff was talking about different credentials and different certifications. These certificates and degrees will allow you to do that. Obviously, a higher salary, and I'll talk a little bit more about that in a moment. Your professional skills, new competencies. You can change career paths here too. Obviously, from the beginning when I was hearing where people were coming from, you're all kind of positioning yourself potentially in a different path. So those are all things master's degrees can do. Obviously, tonight we're promoting the Health Informatics program, but you could go on for an MBA, or there's different options. You'll have more choices of which way you want to go, and you can do that through the accelerated program at Michigan Tech. If you could advance. So after listening to Dr. Hembroff, thinking about this slide was, I gathered a lot of different data from different websites, and this is for all kinds of different programs out there. And the average number that I would usually come up with is that a master's degree would add an extra $500,000 in your lifetime earnings. But like I said, based on what I was just hearing, I'm guessing this is on the low side of the numbers of what's potential for this particular program. So there is a significant return on investment of your time and effort of going into this program of significant money throughout your life. So what is it actually an accelerated master's? It's something for you. It's something for Michigan Tech students. It's designed for our own students to go on into an advanced degree. It's bachelor's plus 1 year is going to basically equal a master's degree. It's a faster, simpler way to move through this process. And we also streamline the application process. So we make it easier for you to apply to graduate school because you're one of our own. So we do have a website, it's mtu.edu/accelerated. We'll have a lot more information. And like I said, you're always welcome to reach out to me if you're interested or have additional questions after this. Why would you consider an accelerated master's? Well, one is going to be speed, completing your master's degree in 1 additional year beyond your bachelor's degrees. Many people who go out and go to different programs, other universities, are probably looking at 2 years of work. So you not only would get into the your field of choice quicker, but most likely at a higher salary. And in your lifetime, earning years, you'll probably end up with 1 more year of earnings along the way because you'll be graduating faster. Cost savings, we'll go back. Cost savings, you'll end up spending less time and money. And I'll go into some of that in a couple slides ahead here. And like I mentioned before, there are also multiple accelerated master's options you can choose from, but obviously tonight we're talking about health informatics. The big thing, this is kind of the key slide. This is where you can optimize everything, is working with Dr. Hembroff and your advisors to make sure that you're getting the most you can out of the accelerated program. And that's going to save you money in the long run too. So double counting credits, you're allowed to double count 6 credits from your undergraduate degree towards your master's degree. And here's the key part, with the approval of the program. So you're going to need to be talking with Dr. Hembroff on the right courses that you're taking as an undergraduate to make sure that you can bring 6 credits across. Because that's a significant amount of time and money that you're going to be able to bring across towards a master's degree. A master's degree is 30 credit hours long. So you're able to actually bring 6 more across. And then senior rule. Actually, senior rule, it's possible to count up to, and this is, actually you can bring across more credits with the approval. You can actually bring technically 10 credits across with the approval of the program. And what happens here is in your senior year, you're eligible to work with the registrar and fill out a form, but you're able to take courses that don't count towards your bachelor's degree, but are separated out on your transcript and can be used for a different degree, like our accelerated master's. So many students we see in their senior year don't have to take like 18 credits to graduate. But if you're taking 12 credits, if you take more credits, the tuition's the same, there's no cost. So many students will pick up an additional course or 2 during their senior year that they can bring across and use towards their accelerated masters. But once again, this takes planning, and it also, you need to make sure you're taking the right courses, and that's where Dr. Hembroff would come in, to make sure you're bringing the right courses across and into the graduate program. So it's all about working with the advisors and graduate directors for programs to make sure you're optimizing all of these credit transfers.
Yeah, and I'll go over, I wanted to reserve towards the end just to show Kay Olivers, who's the academic advisor, her profile for everyone too, because she's another great resource who does a lot for the health informatics program, and she knows all the undergraduate portions for it as well, that a lot of these individuals are in. So I'll make sure that I show that before we go.
Fantastic. So double counting credits, there's probably $6,800 tuition savings right there. Senior rule, you can bring across another $11,300 if you utilized all of those things. there's significant money you can bring across. I talked a little bit about you'll have one more year of earnings compared to students who are in traditional master's programs. And then we have been offering for the last so many years an award called the Graduate Academic Excellence Award, GAEA. And we've been giving $4,500 awards to students who are starting accelerated master's programs. It changes. We have a finite amount of money, and historically we've been doing it by grade point average. The students with the highest grade point averages coming across get the Academic Excellence Award. This year there was a cutoff at about 3.6 was the grade point average. The students with a 3.6 or higher were getting the Academic Excellence Award. I can say for this particular award, apply. Make sure if you're planning on starting in a fall semester, you apply, in January and get that application completed. Because what we'll do is we'll run a report of all the students who have applied and been accepted, and then we do the GPA sort, and we'll start making those awards, and then see what students accept and don't accept, and then if we have additional money, we'll start making more awards. But you want to be in that first pool of applicants. So. And we don't know where the grade point's going to be every year, so don't worry too much about the 3.6. Just get your application in, and we can go from there. So to be in an accelerated master's program, a couple of key things here. You must have and maintain an overall GPA of 3.0 or greater from acceptance into the program to receiving your bachelor's degree. So you need to have a 3.0. When you apply, you're accepted in, and you need to maintain that 3.0 until you graduate to be a fully accepted accelerated master's. The only other one is you must apply and be accepted to the program before you receive your bachelor's degree. You can't wait, get a job, come back later and say, can I get an accelerated master's? Right now it's set up that you do need to go straight through. So you want to make sure that you're applying, you can apply easily up to a year in advance is when our applications are open. So don't wait till later. I would also say apply to, the accelerated master's programs, go to the job fair, see what happens, see what your choices are, because one of the great things about this program and the certificates is they're also available online. So you could go out there, get the fantastic job. Your employer may have an educational benefit where they're going to pay for parts of your master's degree. You're not going to do it as fast, probably if you're employed, you're going to be working full time, but you can just kind of move along and take a class at a time and do that online and remotely. Just because it's an accelerated master's degree doesn't mean you have to do it in 1 year. We're just saying that you have the ability to do that. But if you want to work and take a class at a time and go through the whole program, you can do that. So the other policy that is in place at the moment is you must enter the program immediately after receiving your bachelor's degree. So if you graduate in fall semester, you'll start in spring semester. If you're graduating in spring semester, we do give you the ability to take the summer off if you need to. You could start in the summer, or you would have to start in the fall. So, and like I said, you can take more than 1 year if you do need to take longer to get through the program. Admission requirements. Application is free. You're going to have to do a couple of student statements, a statement of purpose, a personal statement. These are all embedded in the application. A statement of purpose, and we give you an outline for each of these of things to write about, is 3,000 characters, not words, characters. It's about 1.5 pages long. Personal statement is about 3/4 of a page long. I'm happy to review statements of purposes or personal statements if you'd like. I'd be happy to work you through this process. Transcripts are easy. We probably have all of your transcripts already. If I heard somebody was a transfer student, most transfer credits are already brought into our transcripts and we would have everything there. So that's not going to be difficult. You are going to need to get some letters of recommendation. So if you're thinking about this, this is something you can work on now, is reaching out to faculty and making them aware that at some point you're going to be asking them for a letter of recommendation. And when you want to ask them, so would you be willing to write me a strong letter of recommendation? Because people will write letters of recommendation, but you want strong ones. So because you don't get to see what the recommenders actually say. It comes in, they just comes in, and I have seen letters that aren't very flattering. So know your audience, I guess, is the message there.
Yeah, can I say one thing about this? So with students who are already here for an undergraduate, as Jacque was saying, being able to get those from faculty is good. Most faculty have had to write those quite a few times, so they're pretty well prepared for that. So you could get 2 faculty, for example, and if you did an internship or a co-op, then you could be able to get a supervisor there. And so you don't need to make it any more challenging than it already is. But as Jacque was saying, with faculty itself, to write a strong recommendation, but most of them are very accustomed to doing this. So don't feel shy about reaching out to them. A lot of people do, and they should, because they see you and they can evaluate you in the classroom, and that's a great indication for us to be able to see how you perform. So don't be afraid or shy to reach out to those faculty members.
Agreed. And when you do reach out after you've had that interaction, be prepared, provide them with, what program are you applying to? Maybe a copy of your transcripts. What classes were you in? What projects did you work on? Help, they know a lot of students, so kind of help remind them of who you are and the things that you've done and how you've interacted in the past. So so you'll have those letters of recommendation. And then here's a nice little bonus. You may be familiar with the GRE exam, the Graduate Records Exam. For our exam, $205, I believe, is not required. You are a student of Michigan Tech. We're not going to learn any more about you. We already know you. You already know the faculty, so we already know you'll be a good fit for our program. So that is definitely a benefit. If you leave to go to other institutions, other schools, there is a reasonably good likelihood that you will need to prepare for the GRE exam and take that exam. So definitely a bonus there. It's a pretty fast and easy process. If you go to Michigan Tech's graduate school website, there's the apply online free button pretty much everywhere. There's no charge. What'll happen is you start an application. It's name, address, phone number. I want to be in Health Informatics, and a couple of quick questions. And then it's going to pop back up in your My Michigan Tech, which you're already going to use, which you've been using. There's another tab in there, and it'll have for your application. And in there, it's going to have a list of checklist items, and it's going to be the things we just discussed. It's going to be your student statements, your letters of recommendation, and your transcripts. We already have your transcripts, so you don't need those. There's a tool in there for letters of recommendation where you identify the faculty or the person who's going to write them. You put in their email, and it turns into an automated process. We email them a survey. They can fill out the survey, upload their documents. You will see a check mark when they have returned it, so that you know it's done. Your student statements are in there, where you'll actually, you've got the 2 student statements, the statement of purpose and the personal statement, and you can copy paste into the box or type right in there directly, but all that will be in there. So it won't take very much to complete an application. It shouldn't be an onerous process. So, and it all happens in My Michigan Tech, which you're already using right now. So in the actual application, this is a screenshot out of the application. All you'll need to do is, there's a program of study, there's a drop-down menu, you'll select Health Informatics. And then the other one, are you planning on applying for an accelerated program? You click the yes box, and that's all you'll need to do on this particular page. So that'll identify that's what you're interested in. Even if you forgot to check the yes, I want to be an accelerated, your grade point average was above a 3.0, we would probably rectify that for you. So we've made it pretty easy. So it shouldn't be hard to get through the application. So with that, I guess we can turn it over for questions and we'll do our best to answer. And how can we help people?